Welcome to This Explainer. I'm a pelvic floor physiotherapist, and honestly, I see firsthand just how much confusion is out there when it comes to intimate health. So today, we're totally stripping away the myths and diving straight into clinically safe, evidence-based care for your vulva and pelvic floor.
But hey, before we really get into it, I just want to validate your experience for a second. Millions of women experience discomfort, irritation, or even pain during intimacy, and yet so many are just suffering in silence. If you've been secretly dealing with burning or itching, please know you are absolutely not alone. This is a legitimate medical issue, and you don't have to just live with it.
All right, here's our roadmap for today. We'll cover the unspoken struggle, vulva versus vagina basics, the problem with products, building a safe hygiene routine, looking beyond hygiene, and finally, finding the right support. Section 1. The unspoken struggle, breaking the silence.
You know, it's wild. We will literally talk all day long about our 10-step skincare routines for our faces, right? But when it comes to pelvic health, it's just this massive wall of silence. And because of this taboo, women end up spending hundreds of dollars trying to treat irritation that could so easily be prevented if we just had the right clinical knowledge.
Moving on to Section 2, Vulva versus Vagina Basics, Anatomy 101. Okay, people often use the word vagina as a catch-all term for everything down there. But clinically, that's kind of like calling actually scratch that. It's exactly like calling your entire mouth your throat. The vulva is the external genitalia, and that's the part that needs gentle washing. The vagina is internal, and it is entirely self-cleaning. To really understand why the vagina is self-cleaning, we have to look at your vaginal flora. Your internal anatomy naturally maintains a super-specific, moderately acidic environment. We're talking a pH of about 3.5 to 4.5. It produces discharge to actively remove bacteria, dead cells, all that debris. It's like a brilliant self-cleaning oven. You never need to wash up inside because it works around the clock to maintain that delicate balance and flush out the harmful stuff on its own. Section 3. The problem with products, less is more. So here's the deal with those commercial soaps, scented bath bombs, and so-called feminine washes. They are actually stripping away your natural protective oils. They totally disrupt that delicate pH balance we just talked about. You are literally washing away your body's built-in defenses, which triggers intense itching, creates painful microtears, and seriously increases your risk for yeast infections and bacterial vaginosis. Honestly, for most of us, plain lukewarm water does the trick perfectly. But if you're someone who just prefers using a cleanser, you've got to stick to safe, fragrance-free, pH-balanced options. Things like Cetaphil Gentle Cleanser, CeraVe Hydrating Cleanser, or unscented sensitive Dove soap. And please, absolutely stay far away from artificial fragrances, dyes, antibacterial soaps, essential oils, and abrasive things like loofahs. Okay, I really need to highlight this specific warning because it happens way too often. Never use facial cleansers or acne washes containing salicylic acid on your vulva. Salicylic acid is formulated to break down heavy oils on your face. Because your vulva doesn't produce those thick facial oils, these exfoliants will just violently break down your delicate skin barrier. It leads to painful micro tears, severe burning, and leaves you super sensitive to even just your normal everyday clothing. Let's look at Section 4, Safe Hygiene Routine, Step-by-Step Care. This is your incredibly simple 5-step clinical method. First, always use lukewarm water. Hot water strips moisture right out. Second, wash only the external areas, the vulva. Never go internally. Third, use your bare hands because washcloths are just way too abrasive. Fourth, if you do use a gentle cleanser, make sure you rinse it completely away so no residue is left behind. And finally, gently pat the area dry with a soft towel. No rubbing. It really is that easy. But wait, let's pause here for a second. Does this sound horribly familiar? You are doing literally everything perfectly. You're using plain water or a gentle Cetaphil wash. You're wearing breathable cotton underwear, avoiding all the bad stuff. But that burning and discomfort, it just won't stop? Well, if you're nodding along right now, I really need you to listen closely to this next part. Section 5, Beyond Hygiene, Pelvic Tension. When gentle hygiene isn't fixing the problem, the culprit is often physiological. What might feel exactly like a chronic skin infection is frequently just immense tension in your pelvic floor muscles, or highly sensitive nerve endings overreacting, which is a condition known as vestibulodynia. Sometimes, even the tight clothing we wear or the constant anxiety we feel about the pain makes our pelvic muscles instinctively clench up, and that creates this vicious, continuous cycle of burning and discomfort. This is exactly where my field, pelvic floor physiotherapy, comes in to save the day. We get right to the root cause of that chronic pain and tension. Through specialized clinical physio, we aren't just looking at the surface. We're treating the entire muscular and nervous system of the pelvis. We use evidence-based techniques like manual therapy, biofeedback, and relaxation strategies to finally release that tension and retrain your nervous system for good. Section 6. Finding the right support. You deserve care. This is what we do day in and day out at OVA Women's Health. We've built a really safe, women-only environment. The physiotherapists here specialize specifically in sexual health, pelvic pain, and that frustrating chronic vulvar irritation. We completely understand how incredibly vulnerable it feels to seek help for these kinds of things, so we're totally dedicated to making sure the space is warm, private, and absolutely judgment-free. When you visit us, you are getting a highly evidence-informed approach. Your very first appointment is completely confidential. We sit down, we really listen to your story, and we do a thorough assessment. And from there, we build a personalized treatment plan tailored exactly to what your unique body needs. There's zero pressure. Our only goal is to help you heal at your own pace, using real, effective clinical strategies. So if any of this resonated with you today, scan the QR code to book a confidential assessment. We have the tools and the expertise to help you reclaim your comfort. I really want to leave you with this final thought. You don't have to just live with it. Isn't it time to finally stop treating your discomfort as a secret and take that first step toward true healing? Thanks for learning with me today. And remember, you deserve to feel completely comfortable in your own body.